Hello, good afternoon and welcome. I'm Paul Farmer, I'm Mind's Chief Executive, and this is a very warm welcome on a very cold Friday to our very first webinar, Managing Mental Health in Tough Times. First of all, apologies we're starting slightly late. I think the wind's got the better of our technology here, but we very much hope that you'll stay with us for the next 45 minutes for what I think is going to be a really interesting and informative session. We know at the end of this budget week that it's not just the wind out there that's cold for all of us, but it's a bit of a chill wind blowing through the economy at the moment. So why is it that mental health should be an issue that we should all be taking some attention of? Well, at Mind, this is part of a big campaign we're running called Taking Care of Business. And in this campaign, we're really hoping that as many people as possible will think about the importance of mental health in the workplace. So many of you will be familiar with our work. We are probably Britain's best known mental health charity, and we're here to make sure that anyone with a mental health problem has somewhere to turn to for advice and support. And as part of our work, we've heard time and time again about the importance of looking after people's mental health in the workplace. We know how important it is to get that right, not just for the individual employee, but also increasingly because we're now hearing from employers that there's a very significant business case to be had for taking this seriously. And so what we're going to be doing this afternoon in this event, which is primarily for line managers, but I know there are hundreds of you out there watching this event, and you're all most welcome, is to really give you some very practical help, tips, advice and information about how to get this right. I think just to really set the scene as we before we start and hear from our contributors lined up here this afternoon, there's an important kind of context to think about this issue. Some of you may not be thinking that mental health is necessarily a part of your job, but if you are a line manager, I think one of the most important messages is that mental health is absolutely a part of your job. Right now, 1 in 6 workers will be dealing with anxiety, depression or stress. The chances are that whether you're a line manager newly out in your career or much more experienced line manager, that working with an employee who experiences a mental health problem will be a part and parcel of your job. Our recent poll highlighted that for people, work was the most stressful factor in their lives. And although there may be other issues going on in your life that might contribute to that stress, we know that we probably spend most of our waking hours in work, so that's the place where we're probably likely to experience stress as well. And of course it's that stress that lots of us thrive on, but also can become detrimental to our mental health. Next of all, of course, sadly, mental health as a subject has remained an issue that has been shrouded by stigma and discrimination for very many years. And our poll found that there is still a culture of silence, with many people feeling that they can't speak up to talk about their own mental health in the workplace. In fact, our poll found that many people felt that they couldn't talk about the fact that they'd had a day off as a result of a mental health problem or developing stress that they're experiencing. So there's a long way to go in terms of really breaking this down. And so the consequence of that is that mental health problems are affecting UK PLC. They're affecting the economy and they're affecting the productivity of our country. So now some £26 billion is the cost of poor mental health to our economy. And I think the Chancellor, for one, would be very keen to get his hands on some of that £26 billion. We know, though, that managers want to do more to improve staff mental well-being. But quite often what people have said to us is they don't really know where to start. Well, hopefully in the course of the next 40 minutes or so, we'll give you some helpful hints and tips about where to start and also how to develop some of those key issues that you think you might be able to do to improve the quality of the mental health of your workforce. And we know at Mind, through the work that we've been doing in this campaign, that open and supportive workplaces really can make a big difference, both to your workforce in terms of increasing employee engagement, but also to the productivity of your workplace. So from an employer and an employee point of view, there is a good business case to really address this subject. And so we're going to be hearing from a number of people who are going to tell us about their experiences of good quality mental health in the workplace, We also have huge opportunities for you to access information and materials, and we'll tell you a bit about that later on in this webinar. But also the chat room is now live and open, and I can already see people contributing to that chat room, and we're going to put aside as much time as we possibly can to answer the questions that you might have. So please do go ahead, post questions as we go along, and we'll do the very best we can to get through as many of them. And it's great to see we've already got a number of people asking questions about how they can help the mental health of their workforce. So on with our contributors. In this session today we're going to hear from Professor Steve Bevan from the leading think tank, the Work Foundation. We're going to hear from Emma Mamo, who's Mind's campaign manager on this Taking Care of Business campaign, and Ash Tuft, who works for Enterprise Rent Car, which is a car hire business, and I'm very much looking forward to hearing how Ash has approached the support of supporting members of her team who may develop mental health problems. So without further ado, it's time to hear from Steve Bevan. Steve has been at the forefront of thinking about mental health in this area. And Steve, what's the broader context?
Well, I think mental health in the workforce is something that we're increasingly aware of. It's something that, as you say, is something that's still highly stigmatised, but I think we're getting a lot better at talking about it. And it's perhaps worth just setting in context a bit, the nature of the problem and what we can do about it. We're losing about 70 million working days each year due to mental health problems. And that's a very significant chunk of lost productivity for employers at a time when they need high productivity. We know that mental health in the whole population decreases GDP by over 4%. And obviously GDP has been in the news this week, or the lack of it. And therefore, we know that a psychologically healthy workforce can contribute to increased productivity and competitiveness. When you look at what's happening in workplaces, perhaps the most worrying thing is that we're still suffering from a problem of people feeling able to be open about their mental health. A third of people in a survey last year in the UK said they would not be willing to work with someone who has a mental health problem. And I think despite all the good work that Mind and other organisations have done to raise awareness of workforce mental health, the fact we still have a third of people who say that they will be worried about working with someone with a mental health problem, I think is still troubling, and therefore shows how much more work we've got to do. Of course, there are loads of things that affect people's psychological well-being. They can be things like debt or marital problems, issues with childcare and so on, outside work. I guess one of the things that we ought to be focusing on today is what can happen in the workplace to deal with people who are perhaps coming to work with mental health problems that are caused by external factors, but also what it is about work itself that could make a difference to people's psychological well-being. So I'm just going to focus a little bit on the issue of job quality. In the current climate, you could argue any job is a good job, but I think that we need to think very carefully about how the quality of the jobs that we give people to do can be a positive or indeed a negative influence on their health and well-being. Here's a chart. I promise not to show any more charts than this, but this is just a picture of where the UK sits in the league table of EU countries on the number of people who are reporting that they're doing jobs that are essentially intrinsically satisfying. So whether they have control in their jobs, whether they have variety, opportunities to learn new things, discretion over the pace and the order of tasks in their job. And so what this does is sort of paint a picture of a growing intensification of work in British workplaces. And of course, everyday experience will be pressures on, targets are tougher, you're having to do more with less. These are things that most UK workplaces are having to face up to at the moment. And one of the consequences of that is that the pressure on individuals and perhaps their ability to cope or their psychological resilience may be being tested. And I think this is worrying partly because we're also pumping out lots of people into the labour market with lots of qualifications, more qualifications than ever before. Their expectations of work and what it will do for them in terms of fulfilment and satisfaction are probably sky high, and yet we're giving them jobs where actually we're reducing the amount of autonomy that they have. And I think that's a real concern. It's something that line managers can actually do something about on the ground. So what do we mean by good work? Well, you might argue this list is very aspirational, but we do know from the research evidence that people who have access to most of these types of characteristics in their jobs are psychologically healthier, they're better able to cope, and they're also feeling more control. So secure and interesting jobs that employees find fulfilling and developmental is really important for people. Even in jobs where you imagine they're very routine and basic and unskilled, actually people still want to have some intrinsic interest. They want a style and ethos of management that's based on high levels of trust and fairness. They want choice and flexibility and control over their working hours, particularly if they've got domestic caring responsibilities. So having some control over that makes a big difference to people, rather than being a victim of the way the organisation organises things. They want some balance between the effort they put in and the reward they get, because that can contribute to a sense of unfairness or bitterness. Autonomy and control over the pace of work and the working environment is really important to people. And that can just be as simple as, simple adjustments to working hours, or having some influence over decisions that affect you. And then voice, and that can be individual voice or collective voice in decisions that make a difference to the way that their jobs go. For line managers, I think that there are a number of implications. First of all, you know that the people that report directly to you have complicated lives. Sometimes they're happy to share that with you, sometimes not. But part of your job, I think, is just to be a sort of canary in the mine, to spot the early warning signs of anxiety or behavioural change. Even the way people present themselves. Sometimes, people haven't shaved, or they look anxious, or they lose their temper a little bit more regularly. I think you can spot the early signs that people are perhaps suffering from distress or anxiety, and that's the point at which you can begin to refer people to sources of support either inside your organisation or externally. And obviously Mind has resources on their website, but you may have access to occupational health and other support. So your job isn't to be the doctor or to diagnose the problem, but if you're spotting signs of behavioural change or anxiety, then there are things I think you can do to be a good early warning signal and get people help very early on, and early intervention makes a massive difference. The other thing that you can do as a line manager is to think about what the law calls reasonable adjustments. So you have a duty of care in the law, but as a good manager, I think as well, to think about how you can make a tiny adjustments to the way that people's jobs are configured or their working time that helps them redesign the job, either to help them avoid a period of sickness absence because of mental health, or perhaps if they're coming back from a period of sickness absence, to redesign their job, even on a temporary basis, to help them readjust back into work. And that can make a big difference. Those adjustments are often very inexpensive, and they're often temporary. And then just to finish with a quote that I heard a few weeks ago when I was speaking at an event, that the best reasonable adjustment you can make is to have a great line manager. And that just means being empathetic, listening, and actually sometimes the biggest thing you can do is just ask how people are and then listen to the answer. And it gives you a cue to what you can do next.
Steve, thank you very much indeed. I think a really powerful way of helping us to understand some of that bigger question. So let's move on now to hear from Emma Mamo, who is Mind's Policy and Campaigns Manager. And Emma, what do you think have you found has been the best practice for those line managers to become great line managers?
Okay, thank you. So to kind of make this a reality in your day-to-day workplace, we would say to an employer, if you want to address the mental health of your staff well, you need to have a comprehensive strategy that involves a three-pronged approach where you promote well-being for all of your staff, you tackle the causes of work-related mental health problems, and then thirdly, you have the policies and practices in place where you can support staff who are experiencing a problem. And I would say that senior leadership is key to this. Now, obviously, you've come here today because you recognise this is an important issue. However, in your organisation, it may not be seen as a priority, and we've just produced a resource which covers an introduction to mentally healthy workplaces and really talks about the business case for doing this. So that may be something you can use, and you can download it as part of this webinar to start having those conversations. But moving on to what you can do and how you can make that three-pronged approach come alive in your day-to-day approach to how you manage your staff, I would say the first thing around promoting well-being is talking about well-being regularly. Within my team at Mind, we have fortnightly team meetings, and we'll talk about the work we've done over the last couple of weeks, the work coming up, but then also we'll have a team temperature check where I'll say, how's everyone doing? And it just brings those conversations out into the open and normalises it. And also as a manager, it tells me if there's anything that I need to be acting upon. And I think it also creates space, as Stephen said, about talking about work issues and home issues as they can often interact. And it's really important to encourage lunch breaks. I know when you feel busy, all of us feel that actually a minute away from our desk isn't going to help, but actually it really does help you. You know, the day is a day of two halves. And discouraging long hours, I know in certain sectors you have deadlines, you have pitches you have to deliver, you have you know, quite a client-driven environment if you're in agencies. So I know long hours can be a factor, but it's about people having downtime after those pinch points, and then supporting flexible working where possible. Your organisation may not have flexible hours in place, but there is definitely something you can explore with your staff in terms of flexibility at that individual level. And then it's about promoting open dialogue and involving people in decision making, especially around how the team is run, division of work and planning. That can be really important. And then developing trust, ensuring that people know how they fit into the organisation, and encouraging physical and social activities. That can help build, you know, a strong team where you're pulling together. There's huge links between physical activity and boosting mental well-being, and then encouraging peer support and buddy systems. I think peer support and having a buddy is really important for new starters who've just come into the organisation. It's also really useful if you've just changed roles, perhaps someone's had a promotion, and seeking support outside of the line management structure can be really beneficial. So this is something you could put in place within your team. If you wanted to maybe see if you could do it with buddies across teams, then speak to your HR or other managers to see if you can set that in place. But it's a really cheap but effective thing to put in place. And then moving on, if you're looking to tackle the work-related causes of mental health problems, the first place to start is to find out what is having an issue with your team. A really simple way of doing that is at a team meeting to ask people what's impacting on their well-being in the workplace, what's causing stress for them. And then you can try and group it in terms of what do we have control over, so our working hours, how we work together as a team. Then you can start looking at what do we have influence over, so how does the organisation work, how do you work with other teams, and so on, and what's the workplace culture like. And then I guess there are things beyond your control and influence, the external environment, and so on. And that's not to say you can't then manage within your workplace a better way to respond. And then you can look at the things that come under the, you know, what we can control and what we can influence, and that can form your action plan of what you need to address. And you can ask your team to prioritise what they think the key issues are, and then perhaps ask if people want to lead on certain things, so there's a bit of ownership. I think another key thing to ensure you're available and supporting your staff is to hold regular one-to-ones with them, monthly or more frequent if needed. But I think it's really important to go for a kind of agenda where you talk about their general well-being, a review of the last month, what they thought went well, what didn't, what were the challenges and why. And then I think it's really important to ask for feedback about how you've supported them. It's something I do with my team. So if I've done something that's unhelpful, I'm asking for feedback. They don't have to raise that issue with me. And also it builds trust, so I can then give them feedback because it's part of a feedback culture. So I think that's really useful. And I think treating people as individuals, I think what's important is around supported empowerment. So when my manager delegates stuff to me, she'll say, how involved do you want me to be? Do you want to work up some ideas and come back to me? Do you want to run with it? And that's something I use with my team as well, because you know, we all know that a micromanager isn't helpful, a manager who's too distant isn't helpful, and the only way to get it right is really to ask. I think also around, you know, following on from that, if they are finding certain aspects challenging, providing coaching to help them with that, organising workloads and clearly communicating expectations helps. And then publicising what support is available to people. You know, you might have an employee assistance programme, but how often do you advertise the number and what they can offer your staff? So trying to raise people's awareness when they need it. And then finally, if you have been promoting wellbeing amongst your staff and tackling the causes, this should create a culture where people will speak up sooner. And then if someone is experiencing a problem, you can have a conversation with them about what they're finding challenging, what's triggering distress for them, and what you can do to help. And a really useful tool is a wellness recovery action plan, which was originally a healthcare tool, but you can use it in a work context, which just outlines how does mental distress at work impact on my performance, what are the workplace triggers, what are the early warning signs that you as a line manager can watch out for and then intervene, what steps should you take, what's helpful, what's not, and then what steps the individual can take. And then leading from that, you can start putting in workplace adjustments. and I just wanted to talk briefly about a case study to show how simple some of these workplace adjustments can be. So Chloe got in contact with us about the experience she had with her line manager. She had been experiencing depression and was quite scared about telling her manager, but her manager was really supportive, put in some weekly catch-ups to help her prioritise her workload, because that was something she was quite struggling with, knowing what to do first. Flexible working from home sometimes, allowing her to take naps in the afternoon because she felt quite drowsy because of the medication she was taking. And this aided Chloe's recovery and helped her to stay in work while experiencing this mental health problem. And I mean, a quote from Chloe, from what she told us, was that she felt she'd been rewarded for being honest rather than being punished for experiencing a problem. And now I'll hand over to Ash.
Emma, thanks very much indeed. I think there's a whole host of really helpful, simple, easy ideas that line managers can follow to really pursue good quality support for their staff in the workplace. I really love that quote about lunch. The day is a day of two halves, and to make sure you take some time for your lunch break. I think that's something very simple, very easy that all line managers can encourage their staff to do. So enterprise rent a car. We've probably all used some of Ash's cars at some point in the last few years. It's one of Britain's, in fact, a global business that is very prominent. But behind it is a whole team of people providing that kind of support to us who want to hire cars. So Ash, tell us a bit about your experiences as a line manager, as the recovery supervisor for enterprise rent a car.
Thanks. To be honest, I think whether you want to admit it or not, you are going to have a conversation at some point in your career as a manager about mental health and mental well-being with your staff. I think, to be honest, managers are the front line. What do I mean by that? I basically mean we will have those conversations. We will often be the first person that somebody's going to disclose to, because either they aren't certain of where they need to go to get some help, or they need to disclose it for a medical reason, or we are talking to them about their behaviour and about their performance, and they feel that they need to justify that to us. I think it's really important that we start very early on building up the trust with our employees and talking about how they are feeling, because ultimately there is a benefit to us for doing that. We have staff that are more engaged, more motivated, more committed, and ultimately more productive, because we understand what is important to them and what they want to get out of work. So I think, to be honest, that is the central focus of what I try to do as a manager on a day-to-day basis. What makes a difference? I had to go and ask some of my employees what I'd done with them that they felt really made a difference. And one of the things that was high on their agenda was that building trust with them is an absolute fundamental to be able to have those conversations. You need to treat people as individuals and really get to know them. Something that is really important is thinking about how you're giving them feedback. Adapting your communication is something that as managers we hear a lot about, and it is kind of management speak, but ultimately at its heart it is very important. If you've got somebody coming to you who is overly self-critical, why not try telling them only about the good things that they've done? Let them put on the agenda the things that they think didn't go so well, or that they really need your support in, so that then you're helping them along the way. I think it's also really important to create time in your working day to have conversations with your employees. If you need to, book it in. You know, I'm as guilty as all of you out there of not really having enough time and trying to squeeze everything in. So if it's just a monthly touch point that you book in with your employees, do it, and make sure that in that conversation you show a genuine interest in them. What's important to them? What are they doing outside of work? Whether they're suffering from a mental health issue or not, just that fact that you can build that rapport and have those types of conversations will make it easier for them to disclose if they need to. And if they do disclose, I think it's really important that you encourage them to seek support outside of the workplace too. I've got an employee that I've supported for a long time who actually attributes me with saving his life, and I don't necessarily agree, but fundamentally all I did was sit down, encourage him to go to his doctor, made sure he wrote a complete list of all of his symptoms. We went through it, checked that he had everything in there, and then once he'd been, I followed up with him afterwards. And that led to him getting better quicker, but also me understanding where he was. I think you need to explore together practical adjustments that might help. Sometimes it's really small things. Encourage them to go and speak to EAP. If you've got a provider, talk about workplace adjustments, but include the employee in that conversation. Make sure it's open, make sure that they don't feel like they're being pressured into something because they think that that's what you want them to do, but that you ask those open questions and you are solution focused, you talk about the practicals. And ultimately the employee said to me, just being able to have that conversation, not being afraid to have it, has a huge impact. If they don't trust you, they won't tell you. If they think you're afraid of having the conversation, they won't start it. So my top tips for supporting staff, and I hope it really does help you today, is use your time with your employees to get to know them. Get to know them as an individual and build that communication line. Recognising small things that might make a big difference. That's particularly key when somebody is coming back from a period of time off, but also if you know that they're struggling with an issue in the workplace. It might just be that they're holding eye contact with you and they haven't done that for a while, or that they've got through their first week of phase back. Just let them know that you have noticed. And also saying thank you. Always acknowledge that your employees are sharing. It's a very difficult conversation for them to have, and whether you're having it for the first time or the 100th time, make sure that you are thanking them for letting you in and sharing. And make sure that they know that they're really not alone. They absolutely are not, and whether it's other things within the workplace that they can reach out to support them or outside influences, then they really need to understand that they aren't alone. But fundamentally, you'll only be able to have those conversations with your staff if you build that trust with them and create the open culture where you don't judge and you will have any conversation that they need you to have with them.
Ash, thank you very much indeed. Yeah, I think you can tell from your own experience how much you've been able to support staff in those difficult situations. So we now have plenty of time for questions and answers. We've got lots of questions coming up online already. We'll get through as many as we can, but please do keep them coming in. Let's start off by talking about line managers themselves, Steve. So there's a question here from Adam who says line managers often have pressure on them to meet targets, and as a result the well-being of their staff can fall off their radar. How do you get the balance right? Stay focused on the targets but also support the staff. It's that kind of stuck in the middle of the sandwich problem, isn't it, for many line managers? Yeah,
it's a big issue actually, and it's something that we're increasingly finding in some of the research we've been doing within organisations. I mean, obviously, having a group of employees who are well is one of the best ways of making sure you meet your targets. And I guess what we don't want is for the first interaction to be when someone's fallen over or they become ill. So I think there is something to be said about, Ash's testimony. I think is very powerful to be a preventative force in all this and spot the early warning signs. I think the other thing I would say about pressure is that we have to remember that line managers are people too. And we did a study recently where we found over a third of line managers had undiagnosed depression. So the notion that once you get into a managerial position, you're sort of bulletproof and you're invulnerable to all these things, it needs to be challenged. And we need to look after the health of line managers too. And so I think part of the responsibility and challenges that line managers have is to bear in mind that in trying to meet their targets they need their staff to be as well as possible, but they also need to look after themselves. And so all the sources of support that you're advising your staff to seek are ones that you should be thinking about for yourself too if you think that you're in danger of developing a mental health problem.
Thanks. Emma, Lucy asks, how can we help an employee who's suffering with anxiety and depression, who's at times very distressed in the workplace?
I think using the Wellness Recovery Action Plan that I outlined earlier would be really useful, because you can then explore particular triggers within the workplace that will then cause them to experience that anxiety and depression, and then you can try and offset them. I know for myself, last year I lost a family member in quite a tragic accident, and when I came back to work I was okay, but one part of my job that I really couldn't handle was taking calls from people. We often take calls from people who've been discriminated against and are in quite tough situations, and I didn't have the emotional resilience to deal with that myself. So I spoke to my manager and she said, what do you want? And I said it'd be really useful if someone could field my calls for a couple of weeks. So I got back to people by email, or I advised an assistant to get back. So I think it's just having that very individual conversation about stuff they might be feeling, finding particularly challenging, and then how you can kind of temporarily relieve that.
And actually that kind of first conversation with somebody who you can see, you can spot the signs that things somehow aren't quite right, maybe they're very upset. What's the first thing you would do? How do you go about that?
I think, to be honest, you need to use it as open conversations and as open questions as you possibly can. We might have jumped to the wrong conclusion, and it's really important that we haven't, you know, given somebody a label as not being well when that actually might not be what's going on. But I think just how are you feeling? Is there anything you're finding particularly tough at the moment? That can sometimes lead to a really good and productive conversation, because you're getting to understand exactly what that person is finding as their triggers, or they're finding that they're really struggling with.
Okay, thank you. So I think we're looking at individuals and the way in which we can support individuals, but clearly a number of our questions are asking us about this wider working culture. So Sarah says, changing the working culture can seem an epic challenge. Is there any training or other solutions that we can implement in our workplace? And Katie asked similar questions. Suggestions for line managers sound ideal, so thanks Emma and Ash. But how do we make workplaces more flexible and supportive? Can you give us some practical tips? Steve, give us some examples of where you've seen it work really well.
Well, I think that there are lots of, mainly larger organisations, I have to say, who've invested quite a lot in training and awareness raising amongst their line managers. BT is the one, I guess, that people quote quite a lot. And it's clear from looking at the evidence from BT is that if you're off sick for more than 6 months with a mental health problem and you work at BT, you've got an 80% chance of getting back to work, which is phenomenal, absolutely phenomenal. And they've put lots and lots of their line managers through really very short but very informative and empowering training workshops that get people to think about mental well-being and the signs, and essentially, for many of those managers, behaviour that they might have interpreted as being a performance problem historically, they now think about in terms of being about their health. I think that's a really positive thing. And so you can affect the culture by making sure that line managers are well trained and informed. It does also have to come from the top. And that's the big problem, I think, sometimes. We still hear anecdotes from city investment banks where people say, well, sickness is for wimps, or people who have sickness absence problems are a drain on the business and we need to get them out, and so on. I think that luckily that culture is gradually disappearing, but I think unless people at the top of organisations are able to take this seriously and to invest in time and effort to make sure that line managers are trained and that support is available, then progress is going to be slow. But I'm reasonably optimistic that people are getting this.
Okay, and that question of leadership, Emma, we know about businesses like Deloitte where people have become very open even though they're in senior positions. And just talk a little bit more about how we've seen that work.
Yeah, absolutely. What's interesting about Deloitte was one of their senior partners, John Binns, had an experience of depression, and he thought that his career would be over once he disclosed. I mean, he's in a very high-pressured role, 400 emails a day, flying through his work. And actually they said to him, come back when you're ready, don't worry about firing, and all cylinders will stand by you. And he said that he felt more committed to the organisation than he ever had before, but he also recognised that he's quite a high valued member of staff, but he wanted to ensure that anybody else across the firm, if they experienced a problem, they'd get the same support. So he set up a mental health champion scheme where 7 partners are trained in mental health awareness, and anyone across the firm can go and talk to them. So that's really sending the message that people's mental health is valued, and obviously if they are experiencing a problem, that will be supported. And I mean, Steve spoke about BT, but what's great about BT is that they do that 3 levels that we spoke about. They produce information for all staff about well-being to take care of their own. They then train their line managers on soft skills, because often in the UK people are promoted with because of technical skills, but people skills is very different. And then secondly, they have their staff undertake routine assessments about how they're doing, and depending if they get a red or green or amber light, that then is alerted to their manager, who can then respond appropriately. And then they have advanced directives, which is very similar to the Wellness Recovery Action Plan, which outlines what support someone needs. So they map quite closely onto what we say, and they're a really great example.
So there's that combination, there's no leadership from the top, but some
line
very
managers.
practical tools to support people, support people as line managers. I think that's a really important point. Ash, Ellie says she's managing someone who's been off sick with depression, and they're coming back to work soon. What should she say or do to support them when they return?
I think, to be honest, she probably needs to start thinking about doing things now. Something the employee feels comfortable with, and she can discuss it with them, but whether it's meeting up for a coffee or talking to them on the phone, whatever they feel more comfortable with, and talking to them about coming back into work. Their first day is going to be important. It's probably going to be quite a stressful experience for them. So making sure that they've talked through and understood what that employee needs or wants, and then carrying on having that conversation. I mean, a lot of employees want things to begin with and then feel like they can go it alone. So making sure you're regularly touching back with them to make sure whatever you're doing with them is still relevant, and whether they feel like they can be stretched a little bit more. What do they feel they're capable of? What do they feel that they need from you? And really it's the two-way conversation, the two-way discussion about, yes, you've got results that you need to get as a business, we all do, but making sure you bring that employee along with you so that they feel as supported as possible.
And Emma, yeah?
Well, no, something someone told me recently is when they went back to work, their manager came and met them at the entrance and walked in with them, because they said they were feeling quite anxious. I think something small like that to just help them walk back into the office could be, into the workplace could be really powerful.
Yeah, that's really, I think that you're right, it's often they're relatively easy to do, and relatively small things that can make a lot of difference to somebody, especially when they're coming back into the workplace.
The other thing we hear a lot is managers saying, I'm not sure if I'm allowed to contact people when they're off sick. And you can. If you're in doubt about how to do that, then get some support. But actually, quite often people say, I was off sick for all this time and no one ever contacted me. And so you're absolutely right, get involved while they're still off, so you can actually talk to them about how they can come back, but you keep those lines of communication open.
And being able to do that now using text rather than necessarily having to pick up the phone and talk to somebody can make a difference, can't it?
Yeah, I think use the forum they feel most comfortable with as well. If they want to just discuss things by text, just text. If they want to pick up the phone, do that. But everything is what do they need from you? So schedule in those calls. Do they want to be contacted once a week, once a month? Making sure that you're doing what's relevant for that individual rather than what might be easier for you.
And it might be worth mentioning that it reminds as well that the government has a scheme called Access to Work, which people are entitled and employers are entitled to access, which gives support for people who experience mental health problems, and so there's help in place for employers as well as for employees in terms of some of the support that can be funded, and particularly people who might require, people experiencing panic attacks who might require help with transport to get to the workplace. That kind of thing is available with a government scheme that's probably not very widely known.
No, it's not.
No, it's not.
Let's go on and talk about language. Terry has every conversation about mental health always has a discussion about language. Terry says, when training people on managing mental well-being, how do you get over the issue of terminology? Stress management has negative connotations. Is there a better way to attract people to training and development around this area? Steve, what are the words that help people feel comfortable?
It's really important, this, actually. I mean, it doesn't sound trivial, but I think it is important to people. I mean, we've just finished a massive study looking at schizophrenia, and that word just strikes fear into people's hearts. I think it's a big issue, actually, the language. And I've long thought that stress is not that helpful a term sometimes. And although it's a little bit trite, I think that sometimes talking about psychological resilience or coping and so on is a slightly more positive way of thinking about it. We often talk about, even the term that we used to use was incapacity. We need to think about this in a more positive way. So I think that managers have the opportunity to think about what people can still do, despite the fact they might be ill. Let's focus on what they can still do, their capacity, if you like, rather than their incapacity, how you can build their resilience, how you can support coping. I'm not sure stress is that helpful, frankly, and so I'd rather see more positive words used.
And Emma, we're seeing people using well-being as a phrase increasingly in a business context and bringing together mental and physical well-being into that. Do you think that's one of the ways of bringing people into this conversation?
Yeah, absolutely. I mean, I still can't believe our health system separates mental health and physical health. You need a holistic approach. So talking about staff well-being, I think is really helpful because there's so many linkages between boosting someone's physical health to help their mental health. So yeah, I would agree that well-being and resilience are probably quite useful terms.
But it's also important not to shy away from the conversation, is it? I mean, this isn't just about your 5 a day.
No.
This is about looking about mental well-being, isn't it? So bringing people in on a well-being ticket might help attract people rather than inviting people to come along to a stress management course.
And I think what keeps me well at work, what has an impact. How does that manifest? How can we support? So it's having a kind of a conversation that covers all of those points rather than having, just looking at different aspects.
Thank you. Manreet says that he manages someone who recently told them that they've been diagnosed with bipolar disorder. How does he go about supporting them?
Well, I guess it's what I was just saying, well, how does that impact on how you perform at work? What would we need to put in place to offset that? Also speaking to them about how much would they like colleagues to know about what's going on. I think that's an issue. It's very sensitive information, it's people's personal choice. So again, it might just be talking about someone's got a health condition that can manifest in this way. So if you spot this, it's helpful to do that. It's not helpful to do that, and so on. So I think it would just be speaking to the person and saying, what they want to happen.
It's important, isn't it, for line managers, Steve, not to feel as though they have to be psychiatrists or psychologists.
No.
People don't need to know about the detail of this.
No, they don't. I mean, obviously, the better informed you are, the better. And understanding, broadly what bipolar disorder is and how it manifests itself. And obviously, everyone's different as well. Obviously, it's important that person is getting proper medical care. And if you need to get some information about that, then obviously, if you've got an occupational health expert who can help you with that, then that's great. I think often it's back to being led by the individual, because quite often, it's about the individual understanding what might trigger, a period of anxiety or depression or whatever as a result of their condition, and being led a bit by them and helping them, perhaps if they want to, disclose to some of their closer co-workers who might be able to spot those signs and provide early support, or the line manager doing that. But it is sensitive, and it can be something that causes line managers to be anxious. So the more informed they are, the more they're led by the employee, I think the better.
We're coming to the end of this webinar, and in a moment I'm going to ask our panellists to give us their one top tip, the secret of their success as a line manager. But before we do that, let's just have a look at some of the materials that you'll be able to access through the Mind website. And please do, if you found this useful, sign up for the e-newsletter, which is available from the Mind website. There's huge amounts of resources available for you as an employer, resources for employees. Our own training consultancy team, Mind Workplace, always happy to help. And particularly if you want to understand a little bit more about perhaps the condition of somebody who you might be who might be working for you, then there is a host of information available on the Mind website. So just before we close, one top tip, Ash.
Keep having the conversation.
Emma?
Don't shy away from it. I think sometimes mental health, similar to bereavement, people don't want to say the wrong thing, so they say nothing, and that's the worst thing.
Steve?
Be authentic.
Yep.
I think that's a great place to end. If we haven't been able to answer your questions, please do email them in to work@mind.org.uk. If you'd like more help or information, the website details are on the screen at the moment. I'd very much like to thank all of you for joining us. Apologies again for the slight technical hitch at the start. We very much hope that you'll be able to join us again for future webinars, and if you'd like us to be able to help in some way or another, then please do contact us via work@mind.org.uk. Thank you very much to our panellists today, to Ash, to Emma and to Steve. I'm off to have a lunch break. Thank you very much. Goodbye.